I'm stuck at home, sick, on lockdown. All I can do is watch the Olympics and make TikToks. It got me thinking about the predictions that were made about health, especially mental health, at the beginning of the first lockdown in the spring of 2020. Certainly, some of those predictions were a little bit fear-mongery, but lots of them were made in good faith, I'm sure. I mean, it was unprecedented. We didn't know what was going to happen. But note this article, which is from April of 2020. Researchers warn that it might have a significant effect on mental health. Some speculated about soaring suicides, including this guy saying, sadly, I think there's a good chance we could see twice as many suicides over the next 24 months, resulting in 20,000 additional dead. That's certainly something to worry about if that were the case. April 2020, speculation about suicide mortality, a perfect storm. Well, 2020 is over, and what does the data actually show? The overall data is actually pretty promising. It showed that suicide overall was down by a few thousand deaths in the United States. However, there were some populations that experienced increase, including non-whites. And another report I just read that looked at active duty military suicides were up by about 12%. So the data is nuanced as always. Here's a look at the raw data. This bottom line, there we go. And this bottom line shows suicide deaths in 2018, 2019, and 2020. And notice right here, these are the excess deaths caused by COVID in 2020. Add another 300,000 to that for 2021. So what happened? Why the disconnect between the initial fears and the eventual data? Well, it turns out the lockdown affected different people differently. Some people suffered, certainly. Other people actually reported a rise in mental health, a rise in mood during the lockdown, such as this study. One predictor was the big five trait of extroversion, people who need more social stimulation. They experienced a hard time during the lockdown. That probably makes sense, right? But people who are low on extroversion, or introverts, they actually experienced a slight increase in mood over time during the pandemic. Another factor might be the rise in telehealth and especially mental health therapy delivered via distance. There have been quite a few studies on the efficacy of telehealth when it comes to mental health therapy, and they generally find that the two methods are equally effective in the majority of cases. What we've seen is that telehealth is essentially as effective as face-to-face psychotherapy, and retention rates are higher. This has been transformative in some healthy ways, perhaps.